Hello, everyone. How are we doing today? This is Dr. Mehdi. I'm the head instructor at ConfiDentist. And in this short video, I want to talk briefly about the most recent changes in the AFK protocol for the year 2025, just recently announced by NDB. So everything that I discuss here are just based on what NDB recently published. So for more information, do not forget to check the NDB website. The first thing I want to talk about is actually the format and content. There was like a bit confusion and misunderstanding about the number of questions. I just want to make you guys sure that the number of questions are the same as before. So there are going to be like 200 multiple choice questions. For each, only one correct answer can be selected. So it means the exam is going to be exactly the same as what we had for the past few years. So no new changes in terms of the content and format of the exam. Still, we have two formats available. So you can take the exam electronically or at Prometric centers, or you can just go with the booklet format. If you're asking me which one is better, I'm a little bit old school. I prefer the booklet format, but it's still both ways I think are just equally good. If you are comfortable with either ways, the booklet format has this advantage that you can take notes on the question booklets, but it's still for the electronic one, they're going to give you sketch papers so you can write down any notes or anything that you want, especially for calculations. So again, same as previous years, each question has a value of 1. And the lowest score that you can get for one question is 0. So it means a wrong answer to one question does not affect the result of your other questions, okay? One more thing before I start talking about the most important updates that they announced is that still, interestingly and surprisingly, the resources are just the same as last year. So it means the list of references text contains the material recommended in the Faculty of Dentistry are just what they updated in November 2021. So it means almost 3-4 years ago, okay? And as you guys know, the questions that you're going to get in the exams are just based on the most recent updates that we have in dentistry. So I think this is not very accurate, but you guys make sure just go with the most updated references from each of these textbooks that are announced in this reference text list, okay? I'm pretty sure that sooner or later NDB will change this because many of the references in this list are like very old, like at least 1 or 2 newer editions. After those are like out there. So I think my suggestion is go with the newer ones. Okay. So the most interesting update I did is actually for the blueprint of the questions. Okay. So I just want to show you guys first the old blueprint. So this is the blueprint for year 2024 and before. And this is the new blueprint, okay? So the new blueprint looks a little bit confusing at the beginning, but I try my best to demystify this so you can see it's technically the same. Nothing has changed. So they just played a little bit with words, with the numbers, but it's technically the same old blueprint. So the first thing, don't forget, this is just about the percentage of questions. It's not about the number of questions. So it means that whatever you see here, multiplied by 2, and that would be the number of questions because you have 200 questions, not just 100. So when it says for perio, we have 8 plus minus 5% questions. That means 3 to 13%. multiplied by 2. So you have between 6 to 26 perio questions. Is it likely that I'm going to get 6 questions? I would say absolutely unlikely. Very, very unlikely. Okay? But normally the number of questions that you're going to get from perio should be something between like 15 to 25, making it one of the most important subjects for the exam. And this is just, these are just the questions that are coming directly from perio, okay? So direct perio questions. What do I mean by direct perio questions? I mean not including immunology and microbiology, because in the past, immunology and microbiology were part of perio, which they are actually. A huge part of periodontics is actually immunology. If you check Carenza as a reference for NDB, for perio, like there are several chapters of Carenza dedicated to immunology. So by studying those chapters from Carenza, you are actually covering this immunology, which has been like separated from perio and is now part of what they call applied biomedical sciences. Okay, so let me just go start with this new title, applied biomedical science. What does it mean? So right now, they just separated some subjects and some topics from other subjects of the old blueprint, and they just combined them and put them under the category of applied biomedical science. So look at here, anatomy. So where do we have anatomy? Look at here, oral surgery, anatomy. Biochemistry. So you can have biochemistry in cardiology. Biomaterials, part of restorative dentistry. Cardiology, part of restorative dentistry. Growth and development, part of orthodontics, okay? So you see orthodontics, growth and development. Again, you can see like the first few chapters of Profit and Graeber are actually about growth and modification. So they are just kind of separated those chapters and put them under the title of applied biomedical science. Histology. So we have histology again, as part of, for example, where is that? Yeah, you can find the histology here in this list. So it means like it's not a new introduced subject, okay? Immunology, I just talked about it. It's actually, it used to be part of perio, but now they put it as a separate, under the separate title of applied medical science. Microbiology used to be part of perio. Oral embryology, we had oral embryology. It's nothing new, okay, to be afraid of, okay. So for example, you can see oral embryology was part of orthodontics, and physiology, we had physiology before, again, nothing new. So you can see physiology was part of pharmacology. So technically what they did, and I think it's a good thing that they separated these subjects, because, for instance, microbiology, not all microbiology questions are from perio. You can get microbiology questions from endo, okay? So this way, they just put them all the questions that are coming from microbiology are under the applied biomedical science, and they can come from any subject. So they can come, for example, from pathology. So for instance, what is the cause of, let's say, herpes zoster? What is the cause of Kaposi sarcoma? Which virus is associated with oral hairy leukoplakia, okay? Or you can get a question, which of the following bacteria are related to a necrotizing gingivitis or necrotizing periodontitis? Which bacteria is more likely to be found in a case of preimplantitis? Or which of the following bacteria are associated with cases of recurrent endodontic infections, okay? or persistent endodontic infection. So you can see that these are technically endo or perio or pathology questions, but they can also be to some extent related to microbiology, okay? So don't expect to get very, very irrelevant microbiology questions. So all those microbiology questions or immunology or any of those subjects that you have under the applied biomedical science are technically somehow related to these other subjects, okay? So for example, which bacteria is associated to root caries? So this is technically a restorative question, okay? But that would come under like applied biomedical science, okay? So one more time, applied biomedical science is not a new title. It's just parts of other like subjects, for example, microbiology, immunology, growth and development, oral embryology, physiology, and applied anatomy, biochemistry, okay, or microbiology. So now they have combined these subjects all together and put them under one big title of applied biomedical science, and it's just going to be the same thing, okay? It's not going to be like NDB part 1 or part 2. Again, this was just, I was talking to a few of my colleagues and students, and they had this fear, oh, there's the exam is going to be like NDB part 1 or part 2, so they're going to be like basic science questions mainly. No, it's not going to be the case, okay? So that said, it's still by far the most important subjects, even based on the new blueprint, are oral pathology, restorative and prosthodontics, pharmacology, perio, and oral surgery. So still these subjects are by far the most important ones. So when you look at the number of questions, you can see for oral medicine and oral pathology and oral radiology, you're not going to get so many oral radiology questions, max 3-4 oral radiology questions. So you're going to have 15 plus minus 5. So it means 10 to 20 multiplied by 2. So it means there is a chance that you're going to get up to 40 questions coming from this subject, okay? Up to 40 questions. One of the new things that they did, and they did exactly the same with the ACJ blueprint. So if you check the 2025 ACJ blueprint, you will see it's technically the same. So it means they gave a range, which is more kind of, it's more accurate, giving a range instead of just giving an exact number, because there were exams that there was absolutely no question from one subject. For example, there was no question from radiology. And people were complaining, oh, you announced that there's going to be question from radiology, but there is not any. So that's the reason that they just give a range. They just gave a range like this. So when they say for evidence-based dentistry, super important, infection control, ethics, these are all important subjects. We're giving you 5 plus minus 5. So it means between 0 to 10 multiplied by 2. So it means there is a chance that you're going to get up to 20 questions from this subject. And that shows the importance of this subject. So my bottom line is that these numbers should not make you afraid of, like, for example, one specific subject or the other. I think it's still, it's pretty much the same as what we had in the previous blueprint, but just it's kind of like a paraphrased blueprint, or just a little bit like modified blueprint, okay? And now you have more like a range, okay? So one more time, most important subjects: pathology, pharma, perio, oral surgery, okay? And not to mention prosto and resto, okay? There is one more thing I want to mention before I end this quick discussion, and that is it's not about the number of questions that really matters, okay, at the end of the day. It's more about the number of new questions, the number of let me put it this way, the very difficult questions that matters the most. So if you're asking people who took the exam, after the exam, they mainly remember the difficult questions. So there is a chance that in one exam, you had like 40 pathology questions, like 35 pathology questions. But since most of those questions were pretty straightforward, and nobody just remembers those questions as very unusual questions. But if people they had like 10 new questions and very unusual questions from one subject, everybody will talk about those specific questions. So there were exams that people they had many new questions from implant dentistry. There were many new questions, let's say, from a specific classification of caries, a new classification of periodontal diseases. So if you look at the number of those questions, it is likely that the number of questions from that subject is not more than the others. But because they were very new and unusual, people, they say, okay, this exam, we had like too many questions from this subject, okay? And don't forget, if you look at this blueprint, and this is just an example, there is a chance that in one exam, you get 15 plus minus 5. So I said your range is 10 to 20 multiplied by 2. So your range is between 20 to 40 questions of oral medicine, oral pathology, and oral radiology, okay? And then for endodontics, you have 6 plus minus 5. So it gives you 1 to 11 multiplied by 2. So it means 2 to 22, okay? So there is a chance, and I'm just talking about the probabilities. It's very unlikely, but there is a chance that in one exam, you're going to get 22 questions from endo and just 20 questions from oral radiology and oral pathology based on this, okay? It's not very likely, but it is, there is a chance, okay? And if you ask people who took the AFK exam, they're gonna affirm that in their exam, for example, they had more questions from resto, they had more questions from prosto, they had more questions from pharma, okay? So, and that's how it works. So now you have a range, and now you know how it works, okay? So my suggestion is focus on those subjects that are the most important, but still at the end of the day, be prepared that in your exam, for example, orthodontics becomes the most important subject, okay? Or let's say fixed orthodontics becomes the most important subject, okay? But I don't think there is going to be a fundamental change in the structure of questions you're going to get in your coming exam. Do not forget to watch this video that explains kind of like the preparation for the AFK and ACG exam. You can find very valuable information in this video. So I put the link to this video. Make sure you guys go and watch it. And lastly, also make sure you take this exam that you can find on NDB website. This is a self-assessment exam. I know the exam is not very difficult. It's an easy exam, but just take it. I think it gives you a good idea about how some of the questions will work in the exam, okay? But again, the difficulty of the real exam is much, much, much higher than the self-assessments, okay? So wish you guys all the very best of luck in your coming exam, and we'll be in touch in our upcoming ConfiTalk videos. Take care and bye.